Viewers, I hope you are all fine. This ultrasound video shows a late stillbirth with pregnancy of more than 24 completed pregnancy weeks. You can see the Spalding sign. The skull bones are overlapping on each other due to the fetal demise, and the overlapping of the skull bone shows that fetal demise is an event of late past. You can see the overlapping of the skull bones. Now, an early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy, while the late stillbirth occurs between 28 and 36 completed pregnancy weeks. After 26 weeks, that is, a term birth is used when it occurs between 37 or more completed pregnancy weeks. Now, stillbirth is a death of the body baby in the womb after weeks 20 of the mother's pregnancy. The reason go unexplained for 1/3 of cases, and the other 2/3 may be caused by problems with the placenta or umbilical cord, high blood pressure, infections, birth defects, or poor lifestyle choices. Now you can see an encephalocele is also seen along the fetal head. Intrauterine fetal demise is a fetal death that occurs after 20 weeks gestation but before birth. If the gestational age is unknown at the time of birth, the fetus that weighs equal to and more than 350 gram is considered as an intrauterine fetal death. You can see the placenta posteriorly attached, and the lie is transverse with the head of the fetus lying on the right hand side of the mother at the time of examination. You can see there are no fetal movements, no fetal cardiac activity, no blood flow is seen inside the fetus. Confirming the fetal demise. There is a high chance of having significant bleeding when the pregnancy in the second trimester delivers on its own at home. In the case of fetal demise, that fetus that has been in the uterus for 4 weeks can cause changes in the body's clotting system. You can see the femur of the fetus. The highest risk of stillbirth was seen at 42 weeks with 10.8 per 10,000 ongoing pregnancies. But we do know that certain factors increase the risk, and there are simple things you can do to reduce these risks. And these are the early eat healthy and keep active, stop smoking, avoid alcohol in pregnancy, go to sleep on your side, tell your midwife about any drug use, and having a flu jab. Now, the causes of stillbirth, pregnancy, and labor complications. Certain circumstances can make things riskier for the baby before birth. Placental problems, birth defects, and other conditions in the baby. Then there are infections umbilical cord problems, maternal health, unexplained stillbirth. About 2 to 3% pregnancies will be lost in the second trimester, a rate that is much lower than in the first trimester. Once a pregnancy gets to about 20 weeks of gestation, less than 0.5%, that is half percent, will end in a fetal demise. A loss at this time in pregnancy is most often a hard and sad experience. Common causes includes infections, birth defects, pregnancy complications like preeclampsia. You can have tests to try to find out what caused your baby's death and try to prevent another stillbirth in your next pregnancy. Now, the number one cause of stillbirth is placental problems. They were known as the leading cause of stillbirth that took place before birth, and these deaths tended to occur after 24 weeks of gestation. Birth defects in more than one of every 10 stillbirths. The fetal had a genetic or structural birth defect that possibly caused by death. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. Thanks.